Welcome back. Troubling numbers when it comes to prostate cancer. About 300,000 men here in the U.S. are expected to be diagnosed with prostate cancer this year. And the American Cancer Society says more patients are now learning they have the disease late stage. Now, if found early, doctors say this is very treatable, but they say the problem is that many men just are not getting screened.
Joining us to talk about all of this is Dr. Dan Sonnenburg, who's a medical oncologist at Community MD Anderson Cancer Center. And the American Cancer Society says that rates of prostate cancer diagnoses are about 70% higher in Black men than white men. So what are you actually seeing in your practice?
Well, first off, thanks for having me to come in to talk about this important topic. I have certainly seen that there's a higher incidence in African American men, like you mentioned, but there's also, these patients have a higher risk or more aggressive type of prostate cancer that is more apt to try to spread, which makes catching it early very important.
Talk about getting screened. Are men just not going to see the doctor at all, or are they going and they just don't want to be screened?
Absolutely. It's a little bit of both. It's scary to think about cancer, and it's intimidating to think about prostate cancer. I think it's important to know that the guidelines have changed over the last few years. It previously was that for screening for prostate cancer, it was a rectal exam. Fortunately for us guys, they changed those guidelines a few years ago, and a rectal exam is no longer recommended. So a PSA, which is a blood test, which if elevated can suggest that prostate cancer is present, that's the mainstay of treatment now.
And we have some of the risk factors being age, family history, genetics, race and ethnicity. All of these things can come into play when you're looking at this. If you identify with one of these, does it mean that you need to go?
Absolutely. So the guidelines recommend that for men who are age 55 to 70, they have a discussion with their doctor about whether or not they should have a PSA check done. And that definitely involves age, race, family history of cancer. So those are the patients who certainly need to have this testing done to catch this early.
And what are the ages now? When
age
should you
55 to 70, it's recommended.
What if you have a family history?
Exactly. So for a family history, that group of patients certainly needs to, for that age. There's certain people where if they had a family member who was found to have prostate cancer earlier, they might want to start their PSA checks sooner than that age 55 mark.
And lastly, having a diagnosis like this is not a death sentence anymore.
Exactly.
Okay.
Exactly. I think the most important thing to know is that if you do have a diagnosis of prostate cancer, it's important to not just see one doctor, but have a multidisciplinary care approach. At Community MD Anderson Cancer Center for our prostate cancer patients, we have a multidisciplinary care clinic where you meet with a medical oncologist, a urologist, and a radiation oncologist to discuss all of the different potential treatment options, which could range anywhere from just watching with surveillance and repeat PSA checks for patients who have a very low-risk prostate cancer, could involve surgery to remove the prostate, and it could involve radiation, which can be equally effective to surgery in terms of trying to cure the cancer.
All right, this has been super helpful to hear. Dr. Dan Sonnenburg with Community Health Network. Thank you so much for
Thanks for having me. Appreciate it.